Looks like we're live. Thank you for joining us today on Lisa Maas Medicare. If you haven't been to this channel before, I'd love for you to hit the subscribe button, hit the notifications. So each week as I do this, you'll get more information about Medicare. Now, I don't work for the federal government and I don't work for the Office of Medicare. I'm a licensed broker, which means I work with all the different insurance companies in my area, 23 out of the 24 plans, and 8 out of the 9 different companies in my area. I'm in Southern Idaho. We're licensed per state and per county is how these policies run. So it's really important to get somebody local that's licensed in your state. I have a couple of different states, but however, if I am not licensed in your state, I'm going to put a banner up here that shows you my information so you can email me through the website insuranceover65.com or give me a call directly and I will help you find an agent that's qualified to work with you in your state. Because that's what we're going to talk about today. We're going to talk about how to choose your Medicare agent. This is really important. Your Medicare agent, I'm sorry to say, they can probably make or break you because there's all these different policies and each person is different. Everybody has different medications. Everybody has different doctors. They live in different counties and they want different things. You're the consumer. You've worked all these years for your Medicare. So make sure that you choose wisely the person that's going to assist you. And the best part, it doesn't cost you anything. We come with the policies. We're here to serve and help you pick the right policy for yourself. We get paid again by the companies and by Medicare who pay the companies. So we don't charge you a thing. So you might as well utilize our services. All right, this is a really important decision on who you choose to be your agent. Some random person calls you on the phone. First off, it's illegal. They cannot just call you out of the blue. And then those agents that you see on TV, do you really think they know your area and they have the best intent for you? Probably not. So it's a really important decision to find an agent that knows the complexities of Medicare and finds the best plan for you and your needs. So the first thing you're going to want to look for is their experience and their expertise. How familiar are they with the different plans? How familiar are the variety? Do they just represent one plan? Do they represent all the plans? Do they know the latest changes? 2025, we're going to see an awful lot of changes that come down the pike for us. So you're going to want to find an agent. If you don't already have one, you can always call me. You can find somebody local in your area, but I would suggest having them know the latest changes in Medicare. I do about 10 or 12 just in my area of the latest updates in October to let you know what's going down the pike, especially in your drugs. You're going to see some drug deductibles. You're going to see some changes happening there for your policy. So you want to pick somebody that has the expertise and the knowledge to help you look at those changes and look at those decisions. Next thing is you want to make sure they're licensed and credentialed. We have not only a health license and insurance license, but we have to pass a very difficult test called the AHIP every year before we are licensed to sell for the following year. If you don't pass that test, you don't sell, you don't get paid. So we can't assist and help you if you don't have all of those in place. Beyond that, we also have to be licensed with each of the different companies. If you find an agent that's only working with one company, they're only licensed with one company, be a little wary because you want choices. That's your right as a Medicare recipient. You've worked a long time for this healthcare coverage. So you want to make sure that they are properly licensed with all the different companies. And also we have to take CE credits every year. You can go to the state's insurance department and look up that particular person that you're working with. Like for me, you can go to the Idaho State Department of Insurance and look up Lisa Maas, Maas. It shows up. It'll give you a license number. And if I'm qualified for that year, we have to qualify every year to be able to represent you in the insurance market. Next, you want to make sure that your agent is really knowledgeable. Do they know the Medigap policies in your region? Do they know what each Medigap policy stands for and what they represent? Each of the different companies of the Medigap policies. Then you have Medicare Advantage. Are they licensed with all the companies in your area or just one or two? Also, your Part D drug plans. They range from 50 cents to about $120. Are they licensed in all of them, or are they only representing a few of them? Can they explain the differences between original Medicare, Medigap, Medicare Advantage, the Part D, between the different companies? What are your options? What best suits you? There's a lot of things to know and a lot of questions, and it takes a long time to really know and have the expertise. So make sure that they are knowledgeable within your region and within these different categories of Medicare. You also want to make sure that they're giving you unbiased advice, not just to suit themselves, not just to suit one company, that they really represent a plethora of companies and of policies for you. You want to be wary of the agents that only represent a single plan or a single company, and be really wary if they are calling you. They cannot call you unless you give them prior permission or you're in that company already. So for instance, Humana, United Healthcare, if they call you and you're in that policy already, they do have a right to call you. Nobody else can. Even an agent that doesn't represent you can't call you out of the blue. You have to call them or give them permission. So make sure that it's an unbiased agent, that they're working in the benefit to help you. You're the consumer. You also want to make sure that you can communicate clearly and they can communicate clearly with you and keep it simple for you. If you're not understanding and they're talking above you or around you and you can't communicate and they aren't willing to really listen to your needs and answer your questions, you may want to move on, because that's important that you understand what policy you're in, what choices you have, and especially if something comes up, are they there to answer the questions? Do they have the knowledge to answer the questions? Can you understand them? Do they have a heavy accent? The communication is a really important piece. So make sure that you understand and you feel comfortable with the agent that you're choosing, because again, it's your choice. What's their reputation? Do they have satisfied clients? One of the best ways is to ask for references. Or if you find somebody that is really happy with their agent, get a referral. I can give you referrals of my clients. They're super happy with what I do. So referrals are a really good source. I always love when my clients refer people to me because I know they're like kind of people, and I know that I trust that I will be able to communicate clearly and effectively with them. You want to make sure your agent is transparent about their commission. We get paid by helping you with a policy. We get paid by a company. The company gets paid by Medicare. That's how we get paid. You want to make sure they're super transparent. That's the beautiful thing about representing a lot of different companies. They all pay the same. So you're not just getting one company and one viewpoint, you're getting a lot of different viewpoints. That's super important as well. The next is that your agent is focused on your needs. They're focused on what you're saying to them and what you're requiring. I always first say on your healthcare insurance, make sure the most important things is if you go to the doctor, you go into the hospital, all of those things are taken care of first. This is health insurance. The extras, the vision, the dental, the hearing, say if you're somebody that requires hearing aids, you may want to pick a policy that has hearing aid benefits and good benefits for hearing aids. However, if nothing else in the policy works for you, that's not a good policy. So you want to make sure that your agent is focused on your needs, is focused on what you're looking for, and to help you give you choices within what your needs are. Also want to have an agent that's going to give you support. When you call them, do they answer their phone? Are they in your area? Are they able to give you online support or support over the phone, support over the computer, support with challenges that come up? When there's issues and when there's questions, are they there for you? That's a good question to ask. If they're not around, if you can't get in touch with them, that's a big red flag. And then the last is that you want to make sure that they're knowledgeable in your area. These policies are all done by county. Each county, even our counties that are like Jerome County is different than Twin Falls County. They have different policies and they're right around the corner from each other. So you want to make sure that they're a local source, or even if they're not living locally, like I represent Oregon, which I don't live in Oregon, but I know the counties and I know the policies that are in those counties and I know the companies that are in those counties. And you also want to know the health providers that are there for you and the hospital system that's there for you. So those are some really important parts to know when you're picking an agent. And you want to like your agent. You want them to be there for you and you want them to be knowledgeable. So if you don't have an agent and you require somebody to help you, I'm here for you. If I'm not licensed or you're licensed or I can't help you, I will go out and find somebody that is licensed. So that's what I have for you today. We will be back next Friday. Also on YouTube, you can go under the live section and everything that I've done is recorded there for you. So if there's something that you're looking for within Medicare, go there first. Check it out. Give it a like if you're there too. That really helped the channel. All right, thanks for seeing us today, and thanks for being here with Lisa Maas Medicare. I look forward to talking to you again. Have a great weekend. Bye for now.